Welcome to Michael Henderson MD channel. We're so happy to have you here, and we have a special guest today, Elsbeth Fast, that has been a sleep therapist for over 32 years, and she's going to give us more of the history of how she got into sleep, and we are going to just get into the nuts and bolts of something you can apply tonight and today to help you sleep better. One of the main goals of sleeping is to be a more refreshed person, to be a better disciple, be a better father, son, employee, whatever it is, and also helping reverse insulin resistance. So, without further ado, welcome, Elsbeth Fast. So good to have you here. Today, we go into the three top ways to allow yourself to sleep. Some common misconceptions about wearables, about melatonin and other sleep medications. And we also talk about some really cool thought work that you can do to help yourself allow to sleep. So excited to learn from Elsbeth. And Elsbeth, if you could give a little one-liner about yourself, a little bit about your work history, and then something that brings you joy.
Oh, wonderful. Yeah, thank you so much for having me. I've been a clinical social worker for about 35 years, and I'm really passionate about sleep and helping clients to restore natural sleep. I really believe, the fact that we are asleep a third of our lives is an indication that sleep serves a really vital, important function. And some of the ways that we live in modern society and also our efforts to kind of hack our sleep are what is getting in the way of that really natural restorative sleep. So I'm passionate about talking to people about their sleep and helping them.
Awesome. And we're excited to dive in today. Thank you so much. Let's get started.
Thank you so much, Dr. Henderson. I'm so excited to be here. And I love the way you phrased that because I really think of sleep as a gift that's given to us every night.
Mm.
Our bodies are beautifully designed in order to take care of themselves and do things to protect both our physical health and our emotional and mental well-being through sleep at night. So restoring sleep is a way to really restore mood and also conveys a whole host of benefits when it comes to physical health as well.
Right? And both therapist and
And
oh, can you hear me okay? Can you not hear me?
yes, I can hear
Oh,
you.
no, but just from
Yeah.
like a physician standpoint, if you don't want me just saying like, and if as you've been in this realm, it can affect nearly every aspect of life. Increased risk of heart disease, increased risk of diabetes, increased of metabolic syndrome. There's so much, and anyway, there's so much we're gonna unpack today. I cut you off though. Is there something else you wanted to share?
Oh, no, I was just going to say, yeah, I mean, I was going to reemphasize what you said. Every aspect, like even the hormones that control letting us know when we're hungry versus when we're full, are
Yeah.
regulated during sleep. Sleeping, and people get really focused on the quantity of sleep, this magical kind of 8 hours. But what a lot of sleep research tells us is that quality is more important, if not more important than quantity. And the amount of sleep that you require over the course of your life is really dependent on, your age, what's happening with you developmentally, but also on the demands of the day. So
Mm,
sleep is sort of like a very specific prescription based on what's happening with us at that particular time. And we know that when we are fighting a cold or a
yeah,
flu, we're tired. We maybe are more apt to nap, right? And
right.
part of what the body's trying to do by capturing that extra nap during the day when we have a cold or a flu
Mhm.
is to do more immune work to get that under control.
Right. Interesting. My daughter just this morning's like, Dad, I know you left at 5:48. And I was like, how'd you know? She's like, I was awake. I was like, well, maybe your body didn't need as much sleep last night. How do you feel? There's so much to unpack here. Oh, this is so good. I'm just going to sit on that just for a little bit. So if I understand what you're saying,
Sure.
it's like in America, wherever you live, but usually it's like we have like our alarm clock and our time clock where it's like, hey, it's 10 o'clock, it's bedtime, and then I wake up at 5 a.m. You're saying that almost it's like not, that's not like ideal? Is that what you're saying? Sometimes it's less, sometimes it's more?
Exactly, right.
Mhm.
And we move through all of the stages of sleep every 90 to 110 minutes.
Mhm.
So when you first fall asleep, you're in a very light stage sleep called non-REM 1.
Mhm.
Then you move into non-REM 2. Your heart rate starts dropping, your blood pressure starts dropping, your body temperature decreases. Then you move into non-REM 3, 4, which is the deepest, most restorative stage of sleep.
Mhm.
That's where our immune system launches a big defense.
Mhm.
A lot of really compelling research shows that time spent in non-REM 3, 4 is particularly important when it comes to preventing dementia, because that's the
Mhm.
time of night when the brain sort of sweeps away amyloid
Right,
deposits that can
right.
contribute to that. Um, During non-REM 3, 4, the body also releases killer T cells to look for malignancies, or if you have an infection, it'll make an effort to do that. And one of the problems with sedative hypnotics and
Right.
benzodiazepines and other medications for sleep is they alter the architecture of your sleep so they can suppress some of those very critical stages of sleep,
Mhm.
instead of allowing the body to do what it's beautifully designed to do, which is to kind of calculate at night, hey, I'm fighting this viral infection. I need to try to capture a little bit of extra time in
Mhm.
non-REM 3, 4 tonight. After non-REM 3, 4, we move into REM sleep, which is critical for memory consolidation, but also regulating our emotions. So if someone's going
Okay.
through something really difficult emotionally, or
Yeah.
say they just went through new employee orientation at their job and they need to do a lot of memory consolidation that night, the brain will deliberately attempt to do a deeper dive into REM sleep in order to make that happen.
Just
um,
naturally.
but yes, yes, that's how
And
sophisticated our sleep systems
right.
are.
And can I interject a couple questions? You said
Yeah.
non-hypnotic sleep sedatives and benzodiazepines. Also, like about trazodone, alcohol, and marijuana. Like, I don't know, is that also? Because I've read some literature that
Yeah.
marijuana can affect our REM, but
Mm-hmm.
that help with
And
that.
alcohol also suppresses REM sleep.
Hmm.
Trazodone is an older antidepressant
Right.
medication that, is not that great as an antidepressant, but it tends to be sort of sedating.
Hmm.
It has less of an effect on the architecture of sleep, which is kind of reassuring. But what I've found in my work is that people sleep, when we can restore natural sleep, the body's ability to just do its job on its own. And I always tell people sleep is like digestion. Like, sleep happens, it's not something you have to do. And when we get in that cycle of I can't sleep, maybe I need to outsource this to a medication,
Hmm.
we're sort of telling ourselves a story that's not really true, because we are able to sleep naturally. It's a matter, often, of just quieting down our thinking brain
Hmm.
and strengthening our relaxation response in order to
Wow.
be able to successfully kind of surrender to sleep at night.
Sure.
But most sleep researchers and neurologists would, I think, agree with me that natural unmedicated sleep is much more preferable
Right.
to any amount of medicated sleep.
Right. I am
But
very
it's
that as
tricky for
well.
people because not sleeping induces a lot of anxiety. I mean,
Totally.
I've had people call me in tears after 2 nights of not sleeping, and people get really panicky and anxious about it. And that's when our thoughts play a really powerful role. And if you can remind yourself, sleeping is an involuntary physiological process. I cannot make myself fall asleep.
Hmm.
There are things that I can do to set the stage for good sleep. Um, but
Hmm.
then I have to sort of teach myself how to step away and observe what happens rather than being the person in the driver's seat of the car. Like, you are a passenger in the car at night. You're not driving the car. Your body knows how to do that job.
Which is so interesting, right? Some of the people I see with difficulty sleeping do appreciate who doesn't like control, right? But really have some higher level of desire for control, control of their life, control of what they eat, control of how things go. And it's like, a little bit of rigidity where it's like, yeah, now it's sleep time. Let's go. Like it's focused, like, and it's so interesting to hear that it's your ability, your see, it's not, I don't want to make it sound like control again, but allowing yourself to learn how to get into those deeper states of relaxation and see if it
Yes.
happens. Is that what you're saying?
Yes. And you said something so interesting because I mean we know that insomnia tends to run in families. There's some genetic component, we don't know precisely where, but we also know that the personality characteristics of people with insomnia tend to be very results oriented people. They're people that um, they're often very successful in every other area of their life. They're like the
Mm.
kind of people you want to call when there's an emergency, like they know how to get things done kind of people. I
Yeah.
have yet to meet a lazy insomniac. People who have difficulty sleeping are go-getters, and sleep
Mm.
is often the first thing that they've put effort forth, and that effort has backfired. And so sleep is very elusive. Like sleep is something, the more you chase it, the more you try to hack it or make it happen, the less likely it is to occur.
It's like
There's
rainbow.
even a
Yeah.
massive uptick. We have an actual word for it called orthosomnia, which is insomnia that we would normally never see in this population, but insomnia induced by these sleep tracking devices that people wear. So their
Oh, let's
Aura
go.
rings and
Let's get
their,
into this.
yeah.
Yes, please.
And yeah, and it's really interesting, right? Because I'll have clients, just like the question you posed to your daughter about, hey, how do you feel? Do you feel okay?
Yeah,
Maybe your body just didn't need extra sleep this morning, right?
yeah,
But I've had clients tell me, oh, I woke up this morning feeling fine, but when I looked at the data from my watch,
yeah.
all of a sudden I don't feel so
I
fine,
heard that. Yeah,
right?
yeah. Just the other day in clinic. Absolutely. So what do you say to that?
Yeah.
I love this. What is
Well,
your,
I tell them, I say, tell me what you think that device is monitoring, right? It's monitoring heart rate, possibly skin temperature, if it's pretty
right,
sophisticated, and movement, right?
right,
The only way, so sleep trackers, depending on, and there's been a lot of research about
yeah,
the accuracy of them,
right.
and they're quite flawed. Like they,
Really?
they base the feedback that they give you is based on, okay, the average adult ages, 18 to 55 or something,
They
right?
compare you to
But
a
we know,
generalized population.
yes, and it's essentially saying to you, oh, you know um, Michael, your heart rate dropped to 50 beats per minute. We're going
Yeah,
to make the assumption based on the data from the general population that you're in non-REM 3/4 sleep, right? Or you're not moving a lot, so we're gonna
perception.
estimate that you're in
Yeah,
REM sleep right now.
which,
But in reality, if you're on a beta blocker, or you're in menopause, or you're particularly fit where your heart rate goes down fairly low while you're sleeping, right? Or
yeah,
you have a pacemaker, like the data is not individualized to you. Sleep trackers are fairly good at giving us an idea of, like, when they've done studies comparing, they've put people in a sleep lab, done a
right,
polysomnogram, where you have
yeah,
the electrodes on your head, and they've compared polysomnogram data with sleep trackers. They're fairly accurate at telling us the total amount of time someone slept, but they are highly inaccurate when they tell us what stage of sleep someone is in,
really,
because the only way for us to know what stage of sleep someone is in
it's on
is
activity.
with brainwave
Yeah,
activity. And so the
interesting.
the tracking is really problematic, because the
Hmm.
tracking also, I mean, when I see someone for CBT for insomnia, I say,
Yeah,
let's take off that tracker. And for many people, when they stop looking at that data,
yeah.
their anxiety about sleep decreases.
That's so interesting because, and this is practice changing for me, and I'll have to do a lot more literature and learn from you more. But we've been using this to track things for patients to see if interventions have been working. Looking at percent of REM and duration of sleep. Um, but I totally hear you. What's that term called again? Orthosomnia.
Orthosomnia, yeah. And
Interesting.
And
Okay.
people will get sort of fixated, right, on
Okay.
those numbers.
Oh,
And
absolutely.
the issue with sleep is that if you recognize, hey, the amount of sleep that I need to get on a nightly basis, my brain is calculating and figuring that out every evening. So it's going to be variable night to night. And most people with insomnia, they have a strong belief that their sleep very fragile. And that's
Oh,
just not true. Unless a person has like untreated sleep apnea
yeah.
or a circadian rhythm disorder or
Yeah.
something like REM sleep behavior disorder, the vast majority of people have a very robust, intact sleep system.
Yeah.
It's really just their belief that, like if an example would be if I said to you right now, oh, Dr. Henderson, I have to be quiet. I have to really focus on digesting my lunch. You would say, that's crazy. Like your
Cool.
body just does that, right?
Yeah.
So does your sleep system. Your sleep system knows exactly what to do every night. It's getting
Yeah.
that thinking, worry,
Yeah.
sort of control brain, moving that part of your brain to the back seat of the car. That being said, there are things we can do to set the stage for good sleep. And I always
We
tell
should.
people the recipe for sleep are three
Right.
things:
Yeah.
strong sleep drive, which is your hunger for sleep,
Okay.
um,
I'm
a
gonna write this down.
strong and properly placed circadian rhythm. Oh, good, you're going to write this down and we can elaborate on them. Yeah, so a strong sleep drive. Your sleep drive is just like hunger. It's a homeostatic drive.
Okay.
So once you've slept and you've met that sleep drive, you hopefully are not, super tired in the morning, but that hunger, that sleep drive is supposed to start building from morning on.
Okay.
So I always tell people when they say, "Oh, I'm feeling fatigued today," instead of viewing that as that's a negative thing, if you could say
Yeah.
to yourself, "That's fantastic. I'm building my sleep drive for tonight. It's important that I feel hungry for sleep during the
That is
day."
such a mind like flip. Because I mean, yeah, even this week I had some patients with sleep stuff, and it was like, it was almost a fear. Oh, I'm doing something wrong because I'm tired in the day.
Yes.
I didn't get a good sleep. Ah,
Yes.
better get, and then it's like, I better get a good sleep tonight or I'm ruined. So it's almost like it's a flip. It's like, great, I'm building my sleep drive tonight. It's almost like
Yes.
a peaceful moment.
I, I know. I love that.
There's
The
no more.
second element is so number two would be having a strong and properly placed circadian rhythm. And your circadian rhythm is like your internal body clock.
Uh-huh.
And there's actually some testing that I do with people to determine, are you more of an evening person? Are you more of a morning person? Or the vast majority of us are what we call intermediate.
How do you, yeah,
But for
keep
a
that
lot of
like
people,
real quick? How do you know that real fast?
oh, okay, I mean, interestingly, people sometimes know, like I can just ask people, hey, what's your gut instinct? What do you think you are? And then there's actually a measure called the Smith's measure of morningness, eveningness. That's a validated measure that's used in a lot of research, that asks a series of questions about functioning and what time of the day do you feel like you would do well on a test if you had to take it.
Mhm.
It asks a whole series of questions and then you score it and calculate it, and it'll say you fall in the range of morning, intermediate, or evening type. And
Cool.
then we know based on their type, what would be like kind of a normal bedtime for you, right? So for an intermediate
Yeah.
type, a normal bedtime might be between 10 and midnight.
Mm.
Now, if I see a client who scores as an intermediate type, but they're getting in bed at 9 o'clock at night, they're not sleeping in alignment with their circadian rhythm. And our circadian rhythm is it's somewhat fixed. It's sort of like our eye color or our fingerprint.
Yeah.
You can shift someone's circadian rhythm using, small doses of melatonin and
Yeah.
light exposure. Like
Right.
we actually do that with delayed sleep phase
Yeah.
syndrome. We'll will shift someone's circadian rhythm back.
That's what I
Um,
read in lifestyle
or
medicine. That's like the, sorry, if there's a delay in audio, that's why I come in a little late.
okay, yeah,
But
no
that's like
worries.
one of the, that's like the only indication study for melatonin is for for phase shifting. Like if you're going
You
across the world and traveling and anyway, so that's just kind of cool to hear you say it. It's like,
Yeah.
okay.
No, and I love that you're saying that. You know, you're one of the few, I think, physicians that recognize that because people are taking melatonin in such a haphazard, sort of non-evidence-based way. You know, they're taking it believing it's a sleeping pill, and it's not. I mean, if someone tells me, "Oh, I took melatonin and I fell asleep," that's often sort of a placebo effect, you know, but melatonin is an evidence-based treatment for jet lag and delayed sleep phase syndrome. It can be helpful for people who maybe don't get enough light exposure, but most of us have more than enough sufficient melatonin if we get a decent amount of light exposure during the day. And it doesn't have to be sunny, it just has to be natural. You know, when natural light hits the retina of your eye, when
There
you
you
don't
go.
have sunglasses on,
Yep.
it sends an alerting signal to your brain
Night
that
givers.
sets
That's
off
the
like a
super
whole cascade
chiasmatic.
of wakefulness.
Yep.
Yeah.
Yep. And real quick on the melatonin, isn't it like super small doses that actually can help? Or am I way off? I'm saying it's the numbers are like point 0.2,
No.
point 0.5, point 0.5, but I think that's too low. What is like the kind of doses that you do for the
It's like one to 3 milligrams.
okay. Okay.
Yeah, is
Okay.
what is recommended. But
But people are using
the
like
problem,
6, 10 milligrams. It's crazy the amount
10
people are
milligrams.
using.
I know.
And higher. Well,
If you
anyway.
go into
Okay.
Walgreens, there's like a sleep, a sleep section in the pharmacy, and it's essentially one of three things. It's diphenhydramine, which is Benadryl, doxylamine, which is what's in NyQuil, and
Yeah.
high doses of melatonin.
Yeah.
And none of those three things are good for sleep. You know,
Oh,
the
mic drop right
antihistamines
there,
have
Elizabeth. Mic drop.
anticholinergic properties. Yeah. And the melatonin is at such a high dose for many people, it has a paradoxical effect and can increase insomnia. So the third element is having low arousal. And what I mean by arousal fits into two categories: cognitive arousal, which is how effectively can I quiet down my thinking at night? To what degree are my thoughts racing at night?
Hmm.
And most of us, it's easy during the day, right? When we're busy working, or we're going to school, or we're home and the television's on, or the radio's on, or we're busy doing stuff. It's easy to distract ourselves from our thoughts. But at night, that's the time when, and our brain actually has kind of, we call it the articulatory loop of the brain. It's where a thought gets caught in the brain at night. And our brain at night is sort of like a primitive kind of brain. So even something like, oh, I forgot to get hamburger at the grocery store,
Yeah.
the brain at night will capture that in the articulatory loop almost like a threat, and it's like one sock in the dryer going around and around about, oh, I've got to remember my to-do list for tomorrow,
Yes.
or why did I say that at work instead of this, or oh, I don't want to make that phone call that's going to be uncomfortable tomorrow. And so the brain just starts ruminating. So in CBT for insomnia, we work really hard on saying, let's directly address earlier in the day, much earlier in the day, the things that you are avoiding, because if we address them earlier in the day, they're less likely to come and knock on your door at night. And the other
Basically saying,
element of
sorry to
arousal
interrupt
is
real quick.
physiological.
Sorry to interrupt. So you're basically
Sure.
saying like your brain's talking to you and there's something that you feel internally that is important. And if there's been a suppression of it, it's like, well, maybe let's address it. But I think one of the tricky parts of
Yes.
pill interjection is some individuals just have a task list that is just pages. And I don't know, maybe they're not good at prioritizing. Maybe that's the real issue. But they see this high list of all these things to do, and now it's like, well, how do you address that? And maybe that's a whole nother discussion, but I'm just curious.
Well, one thing I'll say about that is if you think of your brain like a wild horse, because our brains are a little bit,
Mhm.
I don't know if you've ever heard that term like monkey brain, but like, our brains are very busy places, right? And they're full of a lot of like distorted thoughts. And when you tame a wild horse, I don't exactly know how you tame a wild horse, but I think you build like a corral and you let the horse kind of run wild, but within the confines of the corral, right?
Okay.
And that's what we do in CBT for insomnia, where we say, whatever you resist persists. So whatever you are avoiding thinking about or dealing with during the day is going to knock on your door at night. So if earlier in the day we give the brain time to worry, to fret, to make a to-do list, and even I'll have clients write down, like even if it's a worry they can't solve, like a big existential worry about something,
Yeah.
I'll say, okay, for this 15 to 20 minutes, you can allow yourself to worry about that, and then you're going to write on your log, I will pick this up again tomorrow, or
Yeah.
I've prayed about this today, I will pick this back up again tomorrow during my designated worry time, right?
That
So
is
it's a
so
way of
beautiful.
for the brain to sort
So
of
beautiful.
fold these things up and tuck them away for the night. We
Yeah.
have to tuck away our worry thoughts at night. The second kind of arousal is physiological arousal, and that's the ability of the body to surrender and really relax at night. And when you've been driving a really long distance, like I drove from Kansas City a couple weeks ago, and I didn't feel particularly stressed out, but when I got back to Fayetteville, I had to like peel my fingers off the steering wheel. And I thought, why am I so tense? Like I didn't recognize the amount of tension I was holding in my body.
Right.
But most of us pull a lot of muscular tension into our bodies to get through the day, and we do not necessarily learn to like unclench from that.
Mhm.
And then at night we get in bed and we're often sort of bracing. So people will report, I feel very tired but wired at night. So
Right.
when we can decrease arousal, that strengthens the relaxation response and also helps the brain to just tuck away some of those worries, where you can really allow the wave of internal sleepiness to take over and do its job.
Wow. So I'm just going to just elaborate, not elaborate, but restate this for those watching how important
Sure.
this is. So our brains are like wild horses out of a corral, and what we resist persists. And so at night, as we're trying to allow, if we're ready to go to sleep, and if there's cognitive arousal, there are things that we've resisted in the day that all of a sudden surface and are just kind of rolling.
Yes.
And a practice that you help encourage the people you work with is to say, let's have a worry 10, 15 minutes. Allow yourself to dig into any areas of your brain and verbalize them, write them down, give them a name, and then give them a corral by saying, I see this as a worry. Thank you for being here. I will revisit you again tomorrow. And it's almost like putting the
You
worries to
got
sleep,
it.
like putting your worries to sleep at an appropriate bedtime, which is before you. And then you can say, I have low cognitive arousal. Let's see if my body's ready to go into state
Yes.
and heal and prevent dementia and diabetes.
You said that beautifully.
Well,
Perfect.
pray this isn't the last time. I hope we get to do many of these.
Yeah, no, let's keep doing this. I love it. This is so fun.
And it just like flows out of your mouth. It's like this is just like you. So it's so cool.
Oh, I love it. It's like I could just talk about it all day. I'm so excited. And yeah, let me know. I'd love
Yeah.
to do follow-up conversations and Q&As and anything that you need. I'm here.
Thank you.
It's so great to see you.
You too. Have a great weekend. See you.
Okay, bye-bye.